Hello, my name is Dr. Tamisha Denis of Modern Smile and Implant Center, and today we're going to talk about what it's like to have an implant consultation in our office. We spend a lot of time talking about why you would need a dental implant in our other videos. So once you have decided that you are ready to start taking the first step towards getting a dental implant for yourself or several dental implants based on what you think your needs are, the first step is a free consultation that we provide in our office. So what we do on that first consultation, we're going to go through step by step so you can kind of know what to expect. The first thing that we do when you come into our office, as for any of our exams, is we give you an iPad so that you can fill out your medical history. Now, some people are not really sure why it's so important for us to know about your physical health. I'm talking about whole body health. And the reason that that is so important for us to know before we do any dental implants or any kind of dental procedures is sometimes you are not aware of how those things may interact. There are a few key things that I look for when we're talking about dental implant surgery and if you're ready to do that. One of those things are if you've ever had any prosthetics or joint replacement. So if you've had your knee replaced or your hip replaced, or especially if you've had heart surgery that involves a valve replacement, mainly a prosthetic valve, we want to know that. And the reason we want to know that is because we will give you antibiotics before the dental appointment to prevent any kind of bacteria from your mouth to travel into your body. Now that's true of any dental procedure and what we call pre-medicating with antibiotics. So we want to know things like that. We want to know if you've ever had a heart attack, a stroke. We want to know if you've had any major surgeries or hospitalizations. We also like to know if you're taking any medications that may interact with the medications we're going to give you for dental implant surgery. For example, or complicate the implant surgery. For example, some people take blood thinners, and when they take blood thinners like warfarin, those sorts of things, it will make you bleed a little bit more. Now, I'm very thorough in the fact that we talk about these things, and in addition to talking about these things, what I also do is if I'm concerned about whether or not we should take a vacation from your blood thinner or a baby aspirin that you may take daily, I will send a letter to your cardiologist just to let them know what we're going to do. So all of those medical history things, whether you think are relevant or irrelevant, we like to put those down on the iPad, and then I go over those things with you. The next step in the dental implant consultation is really having your x-rays taken. So you would tell the dental assistant whom you would meet next what area you are considering getting a dental implant in. Is it an area that is empty and you'd like a tooth there? Or is it an area that you have a tooth that's broken down or is no longer good and we want to take it out and put an implant there? So what they will do is they will take an individualized x-ray, we call it a periapical, of the area, and then we also take what we call a CT or cone beam or 3D x-ray, and that is really the most important part in terms of me, and I'll show you what those things look like, but it's a three-dimensional view of your head or your jaw, and we can actually plan ahead of time where the implant is going to go, what size we should choose, if we have any major structures in the area that will make it difficult or easier, or your sinuses or your nerves, and I can see all of that in your 3D. And I always get patients who are so impressed by seeing themselves in 3 dimensions, they love to take a picture of it, and I don't mind at all. The third step in having a dental implant consultation is meeting with me. So in my office, I do most, if not all, of the dental implants. And when I meet with you, I talk to you about your needs and your concerns. And also we talk about what sites we're thinking of putting the implants in. And we just kind of strategize and plan. Some people want braces before they have their implants or after they have their implants. Some people have special events coming up with, and they want to make sure that they're in the process. Some people are concerned about how much it's going to hurt and all those sorts of things. So we just have a talk, and we just talk about where the implant's going to go, and I start to strategize as far as what I'm going to need in order to get you a dental implant. In addition, we also talk about any concerns that you have. And I'm talking about, again, if you're scared, if we need to give you something to relax you before the procedure, and we talk a lot about that, whether it's a pill, whether it's laughing gas, whether you're going to bring music to listen to, how much time it's going to take. We discuss all of those sorts of things. And that's pretty much it. A lot of that is really, for me, I don't really need that much information besides your x-rays and seeing inside of your mouth, because we do look inside of your mouth to do a clinical exam. But really, it's trying to make you feel comfortable. I want you to feel confident in the procedure, that you're choosing the right thing to do, and it's really a trust building, that we are getting to know each other and that you know that I'm going to do the best for you. The next step in your dental implant consultation probably causes a lot more fear than I do, and that's talking about the financial part. You're going to meet what we call in our office our treatment plan coordinator, and our treatment plan coordinator is going to go through your insurance benefits. They also go through what your co-payments would be, and if you don't have dental insurance, we also go over any cost. Even with insurance, not insurance, we always talk about how to break down your payments into something that is affordable for you. We use companies like Springstone, Lending Club, Care Credit, lots of other companies, and what they do is they will help to finance your dental treatment by making it affordable in monthly payments. It's so important for you to have your dental work done, and we don't want finances to get in the way of that. And we have excellent people who work with people every day to make their dental dreams a reality. So we're going to talk about that, and that's really the next step. Once you have decided that you'd like to have a dental implant placed, the next thing that we do is we talk about your pre-operative instructions. Now, that's all the do's and don'ts of before the procedure, and we give you a little preview of the after. So one of those things that we discuss is what antibiotics we will be taking before the procedure. Sometimes, depending on the circumstance, I'll put you on a 10-day regimen of antibiotics. Sometimes before the procedure, we'll just say you're going to take 4 1 hour before as a preventative measure. Sometimes I will give you something for anxiety, maybe a Xanax, maybe something else, just to kind of take the edge off. We talk about whether or not somebody should drive you to the procedure, how long it's going to take, when they should pick you up. We talk a lot about those kind of pre-op instructions. I also give you a mouth rinse, and the mouth rinse is for cleansing the area before and after the implant, and we also talk about when to use those mouth rinses. We talk about if we should eat before, which is always a great idea to eat before, because you will have dental anesthesia, and when you have dental anesthesia, it's not the most fun to eat after, even though I encourage you to eat something after, just to coat your stomach before taking all those medications. So I give all of those to you in written form so that you can remember all the do's and don'ts of what you should do before your dental implant. The last step in your dental implant consultation is scheduling. Now, timing is so important. I always believe that you should kind of plan for the worst and hope for the best. And I know that's a little negative sounding, but I mostly encourage my patients to do things towards the end of their work week. I have people who work on weekends, so Friday does not make the most sense. Maybe Monday is the best because they have Tuesday and Wednesday off. So if you have the weekend off, maybe Friday or Thursday is the best day to do. I will say this, even though I encourage you to have time off for work or time off from school or do it in time that's convenient for you, most of the time people don't need it. I would say if you take the time off and you're like, what am I doing at home doing nothing? Go to the movies, have a great time. But you want to plan to kind of take care of yourself. Time is the best healer. Rest is the best medicine. So I always say that because it's just really hang out, do nothing. It's nice. Have an excuse to take care of yourself. Eat your foods and just relax. But when you try to do too much activity like exercise, you take away the blood and the nourishment that should be going towards that area for healing and divert it elsewhere. So it's so important to schedule that in a time that's convenient. You don't want to do it before a vacation or a wedding or something that's really important that you want to feel like your best self. A lot of times it's really not the pain medication. A lot of times it's not really the pain that causes you to be so uncomfortable. Sometimes a pain medication just makes you feel drowsy and lousy. So you want to time that accordingly. Thank you for watching this video about dental implant consultations and the different steps. If you're interested in coming to our office and finding out if dental implants are right for you and how that would work in your situation, we do offer a free consultation. Thank you for watching. Be sure to check out our other videos.